Kidney injury, AKI, causes, symptoms, and management. Acute kidney injury, AKI, previously known as acute renal failure, is a sudden and often reversible decline in kidney function. It occurs over hours to days and is characterized by an inability of the kidneys to filter waste products from the blood, maintain electrolyte balance, and regulate fluid levels. AKI is a medical emergency that requires prompt recognition and treatment. In this article, we will explore the causes, symptoms, and management of AKI in detail. What is acute kidney injury? AKI is defined as an abrupt reduction in kidney function, typically measured by a rise in serum creatinine levels, a reduction in urine output, or both. The severity of AKI can range from mild dysfunction to complete kidney failure, requiring urgent medical intervention. While AKI can occur in otherwise healthy individuals, it is most commonly observed in hospitalized patients, particularly in intensive care units, ICUs. Causes of acute kidney injury. The causes of AKI are generally classified into three categories based on the site of the primary dysfunction. 1. Pre-renal causes, reduced blood flow to the kidneys. Hypovolemia, dehydration, caused by severe vomiting, diarrhea, or blood loss. Heart failure, reduced cardiac output leads to decreased perfusion of the kidneys. Hypotension, severe low blood pressure due to sepsis, shock, or medication side effects. Renal artery stenosis, narrowing of the arteries supplying the kidneys. 2. Intrinsic causes, direct damage to kidney tissue. Acute tubular necrosis, ATN, the most common intrinsic cause, often due to ischemia or nephrotoxic agents like certain antibiotics, chemotherapy drugs, or contrast dyes used in imaging studies. Glomerulonephritis, inflammation of the kidney's filtering units, often due to autoimmune diseases or infections. Acute interstitial nephritis, allergic reactions to medications such as NSAIDs, antibiotics, or diuretics. Rhabdomyolysis, breakdown of muscle tissue releases myoglobin which can damage the kidneys. 3. Postrenal causes, obstruction of urine flow. Kidney stones can block the ureters, preventing urine drainage. Enlarged prostate, a common cause in older men. Tumors or masses can obstruct the urinary tract. Urethral strictures, narrowing of the urethra can impede urine flow. Symptoms of acute kidney injury. The symptoms of AKI vary depending on its severity and underlying cause. Early recognition is crucial for effective management. Common signs and symptoms include general symptoms, fatigue and weakness, nausea and vomiting, loss of appetite, swelling in the legs, ankles, or around the eyes, edema. Urinary changes, decreased urine output, oliguria, or complete absence of urine, anuria. In some cases, normal or increased urine output with impaired kidney function. Electrolyte imbalances, high potassium levels, hyperkalemia, which can cause muscle weakness or life-threatening arrhythmias. Low sodium levels, hyponatremia, leading to confusion or seizures. Fluid overload, difficulty breathing due to fluid accumulation in the lungs, pulmonary edema. Hypertension or elevated blood pressure. Severe symptoms, confusion or reduced alertness due to uremia. Chest pain or pressure due to fluid overload or pericarditis. Seizures or coma in extreme cases. Risk factors for acute kidney injury. Certain populations are more susceptible to AKI, including older adults, particularly those with pre-existing kidney disease or diabetes, patients undergoing major surgeries, especially cardiac or vascular procedures, individuals with sepsis, severe infections, or chronic conditions like liver disease, people exposed to nephrotoxic drugs or contrast agents. Diagnosis of acute kidney injury. Diagnosis involves a combination of clinical evaluation, laboratory tests, and imaging studies. Blood tests, elevated serum creatinine and blood urea nitrogen, N levels. Electrolyte imbalances, such as hyperkalemia or acidosis. Urine tests, urinalysis to check for protein, blood, or cellular debris. Measurement of urine output and specific gravity. Imaging studies, ultrasound to detect structural abnormalities or obstructions. CT or MRI in specific cases to identify blockages or masses. Biopsy, rarely performed, but may be necessary to diagnose specific intrinsic kidney diseases. The management of AKI focuses on addressing the underlying cause, preventing further kidney damage, and supporting the patient during recovery. 1. Treating pre-renal causes. Restore blood flow to the kidneys through intravenous fluids or blood transfusions. Manage hypotension with vasopressors if necessary. Optimize heart function in cases of heart failure. 2. Managing intrinsic causes. Discontinue nephrotoxic drugs and avoid further exposure. Treat infections with appropriate antibiotics. Use corticosteroids or immunosuppressive drugs for autoimmune conditions like glomerulonephritis. 3. Relieving post-renal obstruction. Insert a urinary catheter to relieve blockages. Perform surgical intervention for kidney stones, tumors, or strictures. 4. Supportive care. Dialysis. Temporary dialysis may be needed to remove toxins, correct electrolyte imbalances, or manage fluid overload. Electrolyte management. Use medications like calcium gluconate or sodium polystyrene sulfonate to treat hyperkalemia. The prognosis of AKI depends on its cause, severity, and how quickly treatment is initiated. Many patients recover full kidney function, especially when AKI is detected and treated early. However, some may develop chronic kidney disease, CKD, or permanent kidney damage, especially after severe or recurrent episodes of AKI. Preventive measures are crucial to reducing the risk of AKI, particularly in high-risk individuals. These include staying well hydrated, especially during illness or after surgery, avoiding unnecessary use of nephrotoxic drugs, monitoring kidney function closely in patients with chronic diseases, managing conditions like diabetes and hypertension effectively. Acute kidney injury is a serious and potentially life-threatening condition that requires prompt recognition and intervention. By understanding its causes, symptoms, and management strategies, healthcare providers can improve patient outcomes and minimize long-term complications. For individuals at risk, preventive measures and regular monitoring are essential in safeguarding kidney health.